name's Fowler. I'm the chiropodist at the therapy company. What I will do with this patient is, when they first come in, I will do a full record check and a full card check, date of birth, etc. Any medication they're on, are they diabetics, etc. To find out what I need to know with regards to what the problems might be with their feet. Then we will say to them, right, I'm just going to tilt you up slightly and tilt you back so that I can look at your feet easier, and actually it saves me having back problems, which then I would probably have to go and see the osteopath for. Right, so we will do this left foot first. And
that one's on the right.
Left to me. Right, take off the shoes and socks, and really your examination starts from when you take the shoes and socks off, because you can tell so many different things when you first look at people's feet. You look for swelling in the lower leg and the ankles, hard skin, cracked feet. Pop a cushion or a towel underneath to soften that. We then have a look at all of the toes, look at the state of the nails, look in between the toes as well, because quite frequently people do forget to dry in between their toes, and that is when you can start to get athlete's foot, which can take quite some time to clear. I will then record on my record card any abnormalities I see, should there be corns or hard skin. Next thing is I will then proceed to trim the toenails, being very careful that quite often people have skin that grows underneath the toenails, so you have to be very careful that when you're cutting them, you do not cut too far back and nip the skin underneath. When we finish trimming the toenails, one of the things that we will do then is to file the nails in the ends so there are no rough edges left on the nails, because if you leave rough edges on the nails, what can happen is when you're putting your socks on or stockings, you can catch the edge of the nail and tear the nail off, which has a couple of consequences. One, it hurts, and two, it can damage the nail bed, which once it's damaged will not regrow. The major problem we have with large toenails is sometimes they become either ingrown or involuted and can be very painful when they are removed. This patient's toes are not in bad condition. Most people do look after their feet. Unfortunately, a lot of people who I see, particularly ladies, have had problems in the past because of ill-fitting shoes and mainly stilettos, which are not the best for your feet, but nevertheless can cause immense problems. What we do with this is to clean out any debris that is around the nails, which can help to make the nail more comfortable. We will then go onto the nail with a small drill to take off all the rough edges, to then take down all the rough edges off the nails to make them more comfortable. This can be done with a small emery board or file, but will take an awful lot longer than this small drill. Once that is complete, I will then look at the rest of the foot to see if there's any hard skin or corns, and what you can do then is, using a scalpel, you can then pare away any hard skin and corn material, ensuring that you do not nick or cut the patient. Once we have completed that, we'll normally use the drill again just to smooth off all of the hard skin. Once we've completed, for comfort of the patient, we normally do a small massage on the feet, which then gives a feeling of well-being. This we do on both feet, and the procedure would normally take about 30 minutes to complete. Thank you.